we'll start our session. So today is June 3rd, Fast Coder 21's Pre-Medical Coding YouTube Live CPC Prep Session 28. Topic: How to navigate ICD-10 CM Book while attempting the CPC exam. Guys, as I have created one video related to ICD-10 CM tricks for CPC exam. So this video will be extension to that video. So that is not YouTube live, that is only video. So in order to help more, I have decided to conduct this session today. So now we will check the our CPT book, sorry, ICD-10 CM book. So basically, most of the people, even live coders also, they will not check the ICD-10 CM book for the guidelines. But if you see ICD-10 CM book physically, you will get more knowledge compared to using the softwares. See here, expert version, diagnosis codes for provider and facilities. And meanwhile, based on the situation, I will tell you how to use this book for your CPC exam. So see here. So if you have any anatomy questions in CPT exam, CPC exam, you can use here. See chapter 11, anatomy of the digestive system. Here, anatomy of the integumentary system, anatomy of the musculoskeletal system. So you don't need to worry about the anatomy. So sorry guys. So first we will go from page number 1. So here, if you have practical steps, this everyone knows. So in order to success in CPC or live coding, you need to know the symbols and conventions. Yeah, sure, Elena. Basically, hi Vishwanath. Thank you. So basically, if you see here, we have anatomical illustration. So if you have any doubt while writing the exam, you need to check these anatomical illustrations. So while writing CPT codes also, you can check the anatomical body parts here. Anyway, we'll go step by step. So, and if you have any doubt in anatomy of the endocrine system, you can see here, anatomy of the endocrine system. So for like that, we have anatomy for all the systems here. See here, anatomy male reproductive, urinary and female. So like that way, using the anatomy illustrations and these things, you can get rid of like issues about anatomy of the body parts. So we will go ahead step by step. So these are the guidelines. So anyway, you need to master about all these guidelines. So try to read all the guidelines. If you don't know the guidelines, we have sessions up to 14 chapters on YouTube. We can use those chapters. So next we have conventions. All these things, these are all related to our those only. So here you see here we have asymptomatic human immunodeficiency virus. Like these chats, we have multiple in the ICD-10 CM book. You need to follow all these codes. For example, if you want to know use of Z codes, you need to check this one here. So if you have any doubt regarding HIV coding, you need to check this. A patient is seen for a condition and has asymptomatic HIV. So patient is asymptomatic. So here is the condition the patient is being seen for related to HIV or not. So we need to check whether it is not related to HIV. Report the unrelated condition first, followed by Z21. So if it is related to HIV, report B20 as the first exam as well as the CPT books, so that you can get good idea while writing the CPC exam. So all the guidelines are here only. So these are common guidelines. For example, if you see here, we have very big diabetes mellitus coding. So this is useful for all the people who all are working as a medical coder. If you see here, start. We need to start here. Is the type of diabetes documented? No. If it is no, are complications documented? No. Report E119. So it is unspecified. So if the documentations are documented, we need to check for E11. So like types of diabetes, like if it is due to underlying disease, the patient has any complications, yes or no. So you need to check this tree. So usually we'll call it as decision tree. So you need to familiar with this decision tree if you don't know anything. So if you check here, types of diabetes mellitus not documented. So as all of us know, the type of diabetes documented, no. Report diabetes type 2 and report the type of diabetes documented if it is diabetes documented like type 1 or type 2. So like that you need to check your code book. See here, use, abuse and dependence. Use is lesser severe, dependence is more severe than abuse. We have few guidelines related to this, so follow these guidelines here. So these are basically all our CMS guidelines only. So we have guidelines related to pressure ulcer stage course. Here, what is the status of the pressure ulcer during the admission? So it's worsening, same stage, healing. So based on our documentation, we need to choose one. Based on our documentation and scenario. See here, we have coding of pathological fractures. So you need to master about all these trees here. So anyway, these are useful while writing, going for the interview also. See course from chapter 15 and sequencing priority. It is chapter 15, all of us know it is related to pregnancy. So these are related to the pregnancy guidelines. So this is very big one, pregnancy. So if you master this one, this decision tree, so you can write any type of exam. So you can attend interviews also. Share what conditions affecting pregnancy, whether it is diabetes or hypertension. Based on your situation, you need to decide. So here also we have one decision tree coding for traumatic fractures. So you need to check all these things. See, for example, is the fracture open or closed? If it is open, we need to follow this tree. If it is closed, we need to follow this tree. So like that, you need to follow book. So you need to follow your coding books before going to the exams. So these all are related to inpatient coding. So basically, yeah, if you see here, uncertain diagnosis in inpatient coding. So read this guidelines for inpatient coding. So these are very important things you need to familiar. And we have symbols and conventions. So these are also very important. See here, this red symbol caution the code requires additional fourth characters. Why means here they have mentioned 4, 5, 6. Here seventh character. So we need to check the code. If you get any code in the exam, so you need to open your book and check whether do you need to code any additional code or not. So and this blue symbol cautions that the code requires an additional seventh character following placeholder X. So these are Medicare code edit symbols and colors. See here, if you find new, all these codes related to newborn. If you find P, pediatric. If you find M, maternity. If you find A, all are related to adult. Yeah, thank you, Vishwanath. So like that, so here, if you find any code, so there, for example, if you have a question, what is the age for the pediatric code? So you need to check here. So age range is 0 to 17 years inclusive. Example, Ray's syndrome, routine child health exam. So you need to find your options, whether you have 17 or not, 0 to 17 or 0 to 91 or 0 to 21. So here it is mentioned directly pediatric 0 to 17. So you can directly write 0 to 17 or choose this answer. So male code symbol and female code symbol here. So you have few tips also in ICD-10 CM books. You need to follow these tips also, and you may find definitions also. For example, if you have cholecystitis, so if you don't know the meaning, so directly you can go to the cholecystitis and find the definitions. And we have first, second, and these are related to trimesters. And as usual, bulletin is related to new code, and this one is new text, revised code, and revised text. So these are the very important symbol. Try to uh, find these symbols. See here, if you see this symbol, unacceptable inpatient principal diagnosis based on Medicare code edits. So like this, you need to familiar with your code books first before writing the exam. See here, code first. So here we need to code first this code. Use additional code, and code also excludes one, excludes two. So you need to follow all these guidelines. So as I told you before, if you want to learn anatomy, you don't need to worry about here. So for example, if you have like where is external jugular vein located? So how do you find this one? You have options thoracic area, extremities, or neck area or head. So where do you find this one? Basically, these are the neck area. So directly you can find the answer. It is in the neck area. So anatomy you can use like that. So these are the circulatory system. So if you don't know where is sinoatrial node, so you need to find here. It is in the right atrium. So like that for anatomy questions you need to use ICD-10 CM. So these are the related to digestive system. Yeah, we need to check Vishwanath. See here, for example, if you have any question related to large intestine. So if you don't know what are the parts of large intestine, you can check this illustration here. See here, large intestine includes transverse colon, ascending colon, cecum, descending colon, sigmoid colon, rectum. So using this, you can directly write the answer. For example, if you take small intestine has duodenum, jejunum, ileum. So you need to find all these things. So if you know all these things, you can write easily. So for example, if you have question related to common hepatic duct, so you don't know, you can check this anatomy. So here you have mouth anatomy and stomach anatomy. See greater curvature, lesser curvature. So body of stomach, serosa, mucosa, greater curvature. So all these things you need to know. So while coding EGD procedures, we need to know all these body parts. So it is very important for colonoscopy coding. So you need to know all these parts. See here, rectum, sigmoid colon. So basically, you don't need to know anything. Just to, if you know the ICD-10 CM book, how to find, you can write easily. So for example, if you take here, we have ear anatomy. So you need to find what are the body parts. For example, these are related to outer ear. These related to middle ear. Here, inner ear. So you need to identify the body parts. So this is related to endocrine anatomy and hormones. This is eye anatomy, and these are the musculatures. So we have using these musculatures, we have few procedures in CPT also. So this is female reproductive system, internal auspice, cervical canal. So you need to master about all these things. So breast anatomy. If you are coding mastectomy or lumpectomy procedure, you need to know the breast anatomy must. So integumentary system. So if you are coding in integumentary system, you need to know all these things. So for example, you see here epidermis, dermis, subcutaneous fat, muscle. So you need to understand that epidermis is the topmost layer, next dermis, then we will get blood vessels, then subcutaneous fat, then muscle. So you need to understand here that muscle is the lowest or deepest level. After muscle, you will find the bone. So see here epidermis, dermis, subcutaneous, hypodermis. So like this, you need to use this anatomy for your coding exams. So basically, these are useful for live coding also. So these all are related to lymphatic systems. See, while coding neck surgeries and breast procedures, these lymphatic system plays very important role. Like while coding bronchoscopy procedures also, you will find the lymphatic glands. So this hormonal immunity. So this is male reproductive system. So this is musculoskeletal. It's very important. So for example, if you have procedure and greater tuberosity, so you don't know where is greater tuberosity. So you can find here. See here, greater tuberosity. So it is on the shoulder, like humerus. So for example, if you find the wall lateral condyle of tibia, so you don't know where it is. So lateral means inside the body. Sorry, lateral means outside. Medial means inside the body. Lateral means outside the body. So tibial tuberosity. So you need to understand all these things. So this is the bone structure, muscular face muscles. So if you are coding any reconstructive procedures, this plays very important role. Yeah, see all are these very important. So these are all are muscles here. So if you are coding here musculoskeletal foot anatomy. So if you don't know the foot anatomy, you can check here. So these are the bones. So nervous system. So you need to check all these things. So respiratory system. So trachea. These are the lung lobes. Superior lobe, bronchial tree, bronchi. So we need to know the difference between bronchial tree and bronchi. This is the tree-like structure. So bronchial tree, and these are the bronchi. So these are the lung lobes. Right superior lobe, right middle lobe, right inferior lobe. So this is the larynx anatomy. While coding larynx procedure, these cartilages will plays very important role. So we need to know all these things. So if you are working on CPT like endoscopic sinus procedures, we need to know all these procedures. So why means we have individual procedure for inferior terminates like superior terminates and middle terminates. So if you know this anatomy, we can write or we can code endoscopy procedures very easily. So this is throat anatomy. So these are kidney, yeah, kidney. So like that, you need to check all your code books, guys, like anatomy charts. So basically here, while searching the code, you need to search, but mostly you don't need to worry about. Mostly we need to use tabular list here. So I think it is better to go tabular list. Why means most of the instructions provided in tabular list only. So Anyway, you are writing CPC means you must have know all these things. You know how to check the indentation after any code. For example, if you need a buttock with bone involvement, bone necrosis, exposed. This is the main word and these are indented word. So you need to check the combining words here like buttock with. So you need to check the documentation. So these are the neoplasm tables. So anyway, all of you guys know about neoplasm tables. See, this is the tabular list. So we will check. So as I told you before, as we have learned previously, all these symbols are useful while coding. For example, if you see D89.810, this is SEC code. So in order to write properly, you need to remember all these symbols. So these are the endocrine system and chapter guidelines here. So here again you have the anatomy of the endocrine system. See here, for example, if you don't do thyroid stimulating hormone, here you have the wording that TSH stimulates the thyroid gland for the production of T3, T4 and calcitonin hormones. So if you don't know the definition, you need to find the tabular list and write the answer. Guys, if it is possible, please click on like button. So if you click on like button, this session will goes to other people and they will get benefit from these sessions. And also we have anatomy for testes and ovaries. Common pathologies related to this one. So if you don't know the Cushing syndrome definition, how do you check here? Here you can check. This is a condition in which overproduction of pituitary gland hormones. So like that, you need to use this book. So you need to master all these symbols first. Then if, for example, if you take here, congenital iodine deficiency syndrome. Here you need to use the additional code based on guideline. So you need to check F72, F79 series for additional codes. So like that, you need to master your CPT, yes, CPT or ICD-10 CM in order to write the exam. So if you don't know the symbol, you don't need to go to the first page. On the bottom also, you have the symbols. You need to remember all these symbols. So if you take this symbol, Z code as first listed diagnosis only. So we can't code it as second listed. So, but if you have the physical book, you can see all these symbols easily. As it is a PDF version, we can't see properly. So like this, you need to use. So if you are familiar with your CPT and ICD-10 CM book, you can write very easily. So, and you need to check excludes one and excludes two also. So for example, vitamin A deficiency here, E50. Here we can't code sequel of vitamin A deficiency. So if you have E50 series as well as the E64 series, you can directly eliminate that option. Why means we can't code E64 series with E50. So directly you can eliminate that option. For example, if you have one question, what is A vitaminosis D? So you don't know the meaning, but here we have here vitamin D deficiency also called as A vitaminosis D. So you need to know that. See what is a fat pad. So basically fat pad is localized adiposity. We can otherwise call it as fat pad. Yeah, nothing complicated, guys. You need to master your ICD-10 CM book as well as CPT book and as well as the guidelines related to those code. For example, if you see here, tumor lysis syndrome. If you have any doubt while doing the live coding, you can check coding clinic here, quarter 1 2020 and quarter 2 2019. So those coding clinic updates, you will find tumor lysis syndrome. So you can check those like that also. So this is related to mental behavior and neurodevelopmental disorders. See here, for alcohol dependence, see official guidelines. Medical condition due to psychoactive substance abuse and dependence. So you need to master this. So while live coding also, we need to familiar with our code books. So if we familiar with our code books, we can code properly. Yeah, most of the times like that only. Just you need to understand the symbols first, then code first underlying cause like these guidelines, and you can do good. So while coding, live coding, if you have any doubt about phonological disorder, so we can check AHA coding clinic quarter 4 2017. So we will check this coding clinic. Anyway, in CPC exam, you don't have access to coding clinics, but while doing live coding, we can check quarter 4 2017 coding clinics. So these are nervous system. So if you don't know about nervous system anatomy, from here also you can find the anatomy. So what are somatic nervous systems like that? So you don't need to have any anatomy book. APC, this book is very useful. So what are the spinal nerves? So these are the 31 pairs. What are included? You need to remember all these nerves. If you have any question related to spinal nerves, directly you can go to the nervous system section and you will find all these things. Yeah, most of the chapters like that only. So basically all the chapters having their guidelines. So based on your requirement, you need to go that chapter and find the anatomy illustrations and definition about any word. And also you need to master about all these symbols. So why means we can't code male code for female, female code for male. So if you know these symbol, you can code properly. And like that only, we can't code pediatric code for adult, adult code for pediatric. Why means if you are doing live coding, we have softwares, they will guide us. But while writing the CPC exam, you don't find any softwares in order to find these errors. So you need to cautious about selecting the code. So these all are related to prenatal period, perinatal period. Hi Sarika. See, for example, if we take respiratory distress syndrome of newborn, we have one coding clinic Q2 2019. So you need to find that. So if you want to like get complete ICD-10 CM marks in CPC, CPC exam means you need to familiar with your code books. If you are familiar with your code books, you can get full marks. So why means you don't need to remember anything, everything in the book only. So you don't need to do any more hard work related to ICD-10 CM. So these are related to symptoms. See here, for example, you have cachexia in the question, and they will provide wasting syndrome, thyroid disorder like that. How do you code? You need to choose wasting syndrome, as cachexia otherwise called as wasting syndrome. So if you know that in book we have word related to cachexia, you can write the correct answer. So basically in CPC exam, you don't need to worry about ICD-10 CM, everything on the book only, but you need to worry about only CPT procedures. Yeah, here we have cranial nerves anatomy. So you need to have knowledge about all these things. Just open your ICD-10 CM book page by page. So you will get good understanding. So basically what are included in the ICD-10 CM like that. So these codes are related to bonds. See here, these are related to poisoning adverse effects. So you need to read these notes also here. The drug giving rise to the adverse effect should be identified by use of codes from categories T36 to T50 with fifth or sixth character of 5. So these are related to adverse effects. So you need to remember what are the codes for adverse effect range. So if you want to know chapter specific guidelines with example scenarios, Fastcoder 21 is having chapters until 14 and 19. So you can watch those videos along with sample scenarios using the playlist ICD-10 CM. So here these all are related to jet codes. So just we need to follow the book guidelines. For ICD-10 CM, you don't need to remember anything. For CPT bit complicated, you need to remember. So for ICD-10 CM, everything in the book only. Yeah, guys, this is the thing I would like to tell you while writing the CPC exam. So if you want anything other than this, please mention in the comment section so that we can discuss and conclude this session. See here Z codes for long-term use of drugs. So for example, if you find the documentation with Actos, we need to use Z79.84. If you find Advair, we need to use Z79.51. If you find Advil, Z79.1. So like that, you need to master your CPT book and also ICD-10 CM book. So tramadol, opiate analgesic. So tramadol is for pain control as it is analgesic. So these are the changes. So these are the depression code description change. This is the previous description. This is the new description. Difference only elsewhere is added in new description. Here is the difference. So this is the thing I would like to tell you guys. So anyway, it is very simple session only, but I want to tell you that you need to follow like this. So I will wait until 10:15. So afterwards we can conclude this session. Yeah, Sarika, go ahead, Sarika. Do you like to tell anything? So I will wait for 7 more minutes. So I will afterwards I will end this session. So meanwhile, if you have any concern, mention in the comment section. So we have 5 more minutes. Yeah, same lucky. But tomorrow, as a change, I am planning for CRC certification. But anyway, lucky CRC certification also very useful. You can attend that. Same time, 9:15. So same time, lucky. So we can meet at same time tomorrow also. So if anyone forgot to click on like button, please click on like button so that this video goes to more people so they will get benefit from yourself. So good night, guys. So we will meet tomorrow.